Hey, it's Ian, back ranting and raving about the topic of head and neck anatomy. So we have craniofacial vasculature, which we're going to split up into two separate topics. Today we're talking about the craniofacial arteries, and in the next one we'll be talking about craniofacial veins. So let's get right into it. Let's do a very quick review of the aortic arch to better conceptualize how we achieve craniofacial blood flow. Branching off of the aorta, we have the brachiocephalic artery. Then we have the left common carotid artery, and then we have the left subclavian artery. So it's as easy as learning your ABCs, all right, guys? So A as in aorta, B as in brachiocephalic, C as in common carotid, and then S as in subclavian. Because remember, it's ABCs, like with the S at the end, so it's ABCS. All right, so we will mostly focus our attention on the carotid arteries. So the right common carotid artery branches off of the brachiocephalic trunk at the level of the right sternoclavicular joint, while the left common carotid artery branches directly off of the aorta. So we'll split up our discussion of the craniofacial arteries into the right external carotid artery and the right internal carotid artery. So looking more closely at the internal and external carotid arteries, we can appreciate numerous branches that accumulate to the overall blood supply of the head. So we'll discuss each of the high yield points coming up in this video, but for right now, we're talking about the internal carotid artery. So we won't go into too much detail for this exam, but it's important to know that these generally supply the more superior portion of the head. We can see that the important vasculature of the brain, including the circle of Willis, arise from the internal carotid artery, as well as the ophthalmic artery supplying the eyes. So the main focus from here on out, the real meat and potatoes, will be the external carotid artery. The name of each artery orients us to the region and associated structures that are supplied. So we will focus most closely on the more high-yield branches for the purposes of the exam, namely the facial and maxillary artery. However, I do want to note that there are 8 total branches of the external carotid artery. So we're starting with the superior thyroid artery, and then we have the ascending pharyngeal artery, and then we have the lingual artery, the facial artery, the occipital artery, the posterior auricular artery, the maxillary artery, and the superficial temporal artery. So you see that turquoise-ish color, and you know that's a high-yield topic. So this one is that the temporal mandibular joint, or the TMJ, is supplied by the superficial artery. So back to the arteries, I have a great mnemonic device for you guys to remember all of these. And that is, some anatomists love failing over-prepared medical students. And on top of that, it's also super important for you to know that the lingual artery is a branch of the external carotid artery. So let's switch gears a little bit and talk about the inferior alveolar nerve block. When administering an inferior alveolar nerve block, it's crucial to understand the anatomical order of key structures from anterior to posterior. So we have 3 components: the inferior alveolar artery, the inferior alveolar nerve, and the lingual nerve. Clinically, this knowledge is essential for precise and effective anesthesia. So after targeting the inferior alveolar nerve, the needle must be repositioned anteriorly to anesthetize the lingual nerve. Additionally, if the needle is placed too far posteriorly while numbing the inferior alveolar nerve, there is a risk of inadvertently injecting local anesthesia into the artery or even further back into the vein. This can lead to systematic effects, particularly due to the presence of epinephrine in the anesthetic solution. And now, to reinforce our high yield point, I'm going to ask you guys a question. Okay, so example question 1. The temporal mandibular joint, or the TMJ, is supplied by which artery? So those are the answer choices. Pause it if you want. But the answer is D, the superficial temporal artery, which is a branch of the external carotid artery. So this supplies the TMJ. So looking more closely at the internal and external carotid arteries, we can appreciate the numerous branches that accumulate to the overall blood supply of the head. Focusing more closely on the facial artery and its branches, we can see that we have the ascending palatine artery, the angular artery, the tonsillar artery, the glandular branches, the inferior labial artery, the submental artery, and the superior labial artery. Again, the name of each artery aptly orients us to its respective location on the face, so it is straightforward to understand what areas of the face are supplied. A good mnemonic to remember these branches is all amazing tigers go in small steps. So finally, we'll move on to discussing the maxillary artery. Now this diagram looks overwhelming right now, but we'll discuss the branches in segments to help make it easier to digest. The order in which these arteries appear doesn't really matter, and it's not important for the exam, so don't focus on which branch appears before the other. So I'll quickly list off the first 5 and then go into each one. So looking at the first branch, we have the deep auricular artery, the anterior tympanic artery, the middle meningeal artery, the accessory meningeal artery, and the inferior alveolar artery. So the deep auricular artery supplies the ear canal, the outer layer of the eardrum, and additional vascular to the TMJ. The anterior tympanic artery supplies the tympanic cavity, or the middle ear, the inner layer of the eardrum, and the ear ossicles. The middle meningeal artery supplies the dura mater of the brain, bones of the cranial vault, and the frontal and parietal regions of the skull. The accessory meningeal artery supplies the dura mater as well as the structures within the infratemporal fossa, including parts of the trigeminal ganglion and adjacent muscles. Finally, the inferior alveolar artery supplies the mandibular teeth, the gingiva, the mylohyoid muscle, and the skin of the chin. This is via the mental artery, which is a terminal branch of the inferior alveolar artery. Now, I bet you guys are thinking, where's the mnemonic for this whole thing? And it's been at the top this whole time. The mnemonic is, damn am I? As in, damn am I a genius when I remember the first segment of the mandibular artery? And the answer is, of course, yes, but we have to move on to the second segment, the pterygoid. Okay, so now looking at the second segment, we have the deep temporal artery, the lateral pterygoid artery, the medial pterygoid, the mesenteric artery, and the buccal artery. So the deep temporal artery supplies the temporalis muscle and the temporal fossa. Then the lateral pterygoid supplies the lateral pterygoid muscle, which, as a review, helps to open the jaw, protruding the mandible, and moving the jaw from side to side. Then we have the medial pterygoid artery, which supplies the medial pterygoid muscle, which helps to close the jaw. The mesenteric artery supplies the masseter muscle, which is the muscle of mastication, as well as accessory vasculature to the TMJ. And finally, the buccal artery supplies the buccinator muscle, the mucosa of the cheek, and the skin of the cheek. And for this mnemonic, we got another good one. It's two lovely monkeys make breakfast. Finally, the third segment of the maxillary artery includes the artery of the pterygoid canal, the pharyngeal artery, the greater palatine artery, the posterior superior alveolar artery, the sphenopalatine artery, and the infraorbital artery. Now, it sounds like a lot, but that's why we have a great mnemonic, which is Terry plays great piano symphonies inside. Now, of course, because the mnemonic starts with Terry, we have to start with the artery of the pterygoid canal, and this supplies the upper part of the pharynx, the auditory tube, and the tympanic cavity. And then we have the pharyngeal artery, which supplies the nasopharynx, the sphenoid sinus, and the auditory tube. And then we have the greater palatine artery, which supplies the hard palate, the palatine gland, and the soft palate. And then we have the posterior superior alveolar artery, which supplies the maxillary molars, the maxillary sinus, and the maxillary gingiva. Then the sphenopalatine artery supplies the nasal cavity, the nasal septum, and the lateral walls of the nasal cavity. And then finally, we have the infraorbital artery, which supplies the lower eyelids, the upper lip, the upper cheek, the infraorbital region of the face, and the maxillary canines and incisors. Now, if this seems like a lot to you, it is. But if Terry plays great piano symphonies inside, then you can remember the three segments of the maxillary artery. So now let's move on to example question 2. From which major branch artery does the lingual artery arise from? So the answers are the internal carotid artery, the external carotid artery, the glossal artery, the vertebral artery, or the middle cerebral artery. So take a second to think about it, but the answer is B, the external carotid artery. So this means that the lingual artery arises from the external carotid artery. So on the right-hand side, you can see the lingual artery and the external carotid artery. Now, the lingual artery is clearly a branch of the external carotid artery. Now let's move on to a review of everything that we looked at today. So the first thing we touched on is that the lingual artery is a branch of the external carotid artery, the superficial temporal artery supplies the TMJ, and the lower lip is supplied by the inferior labial artery. Thank you so much.